terms that used in private practice. One is failure to thrive. What is failure to thrive?
A failure to thrive is when a patient doesn't meet their growth potential. They usually are falling off their weight and or their height curves at least two percentiles.
So in other words, if a kid was growing at the 50th percentile of weight, drops down to below the 25th percent, because we go 40, 25th, it's a little bit of a red flag. Is that correct?
Yes.
And if we get down to a third percentile, that's big problem. Is that correct?
Especially if they're growing at the if they were growing at the 50th percentile, because then what will happen is the poor weight gain will impact on their ability to grow in length.
It affects the whole body, function, intelligently, and everything. So in other words, if a kid's growing at the 5th percentile all the time in weight, that is just a small kid weight-wise, but it's not failure to thrive. Is that true?
Right. A failure to thrive would be somebody who's actually fallen off their already established weight and height curves.
And the one exception would be a child that just doesn't gain weight from birth.
Usually they'll be following their own curve, even as you mentioned, even if it's the 3rd percentile, they'll usually follow the 3rd percentile. They'll follow their own curve. They won't fall off of it.
What are some of the most common reasons for failure to thrive?
The most common reasons are inadequate calorie intake. That can be due to emotional reasons. It can be due to behavioral reasons. The medical reasons that can cause failure to thrive include things like cystic fibrosis and celiac disease, problems in absorption, problems in usage of the energy that you're taking in, and malabsorption.
Okay, there are some conditions that doctors pull out of their head, but has to meet the criteria. It's a kid that was growing at one rate and decelerating by at least 2 standard deviations. Is that correct?
That's correct.